This conference will now be recorded.
Okay, good morning, everybody. Is my voice audible?
Yes, sir.
Okay. So today we will learn another CNS depressant, uh, another drug of abuse called heroin. So we know we have seen um, morphine poisoning. So opium, we have seen opium poisoning. We have seen alcohol poisoning, and then another important is heroin. Heroin mostly it is a drug of abuse, most of the youth, and it is a recreational drug. What is recreational drug? It is a drug which modifies, it recreates your feelings. So there are three types of recreational drugs. One are depressants. The second one is stimulants. Number third one is hallucinations. So stimulants is one which stimulates your feelings. It will increase your energy levels. Depressants are one which will have a relaxing effect on your mind and your body, and then have a calmness. And then hallucinations, where there is a distortion of your feelings. So because of that, these uh, drugs are used as a recreational drugs. So heroin, otherwise called as brown sugar, it is also called brown sugar. It is another name for heroin is diacetyl morphine. Diacetyl morphine or diamorphine. Diacetyl morphine or diamorphine or heroin. So all are the same, are the brown sugar. So how this heroin is produced? It is produced from acetylation of morphine derived from natural opium source. So it is produced from morphine, and it is produced by acetylation of morphine, which again we know that morphine is from the opium. And then in 1898, heroin is used as a cure for morphine addiction or opium addiction. Heroin is used as a cure, as a maintenance dose for morphine addiction. And there are three types of heroin. One is white, black, and black tar, brown and black tar. So white, brown, and black tar. And then the street heroin is known as smack or junk or dope, and it is normally diluted with quinine, lactose, mannitol, etc. So street heroin is known as smack, junk, or dope, and then heroin plus cocaine is known as speedballs. Heroin plus cocaine both combined is known as speedballs. So these are some of the terminologies you need to have. Speedballs, and then smack, junk, dope, white, brown or black tar, brown sugar. So heroin addiction is the most dangerous of all the drug addiction. So as with other opioids, diacetyl morphine is used as both a medical drug as well as recreational drug. Medically, this diacetyl morphine, otherwise called as heroin, is used as an analgesic, cough suppressant, and also as an antidiarrheal. And it is also mostly used as a recreational drug, in which the user uses to seek euphoria, a sense of well-being, and it is illegal to manufacture, possess or sell heroin without a license. Conviction for trafficking heroin carries the death penalty in most Southeast Asians and some East Asian and Middle Eastern countries, among which Malaysia, Singapore, and Thailand are the most strict. The penalty applies even to the citizens of countries where the penalty is not in place, sometimes causing controversy when foreign visitors are arrested for trafficking. So, whatever it is, so it is illegal to manufacture, possess, and sell heroin without license. If anybody is caught, if anybody is convicted, and death penalty is there in some of the countries like Malaysia, Singapore, Thailand. It is used, both heroin is used medically and then recreationally. So heroin has grades. It has 4 grades from 1 to 4. The 4th one is the purest form, purest grade, which is white powder, which is in salt, to be easily dissolved and injected. So the purest form is normally, it is in a white powder form and it is dissolved, sometimes heated. You can observe some in some movies, they will heat with a spoon, and then after liquefaction, after the powder liquefies, they will take in an injection form. And then number 3 is brown sugar. It is for smoking. And number 1 and 2 grade are their unprocessed raw heroin. So these are the 4 grades of heroin: grade 1, grade 2, grade 3, grade 4. And grade 4 has the highest form of purity, which is a white powder. So heroin has different routes of administration. It can be administered by smelling. By smelling is a snuff. So it is kept under the nose and then it is sniffed, and then it can be smoked through cigarettes or bidis. It can be inhaled, usually by heating on a piece of silver foil, and then the vapors are inhaled, and then it can be also injected either by subcutaneous or intravenous. Intravenous, they are called mainliners, and subcutaneous, they are called skin poppings. So all the routes are there. There is injection, subcutaneous or intravenous. Inhalation is there, where heroin is heated in a silver foils and then the fumes are inhaled, and smoking of heroin through cigarettes and bidis, and then sniffing or sneaking from the nose. So these are the pictures you can see here. The first picture is IV route, intravenous. The second one is sniffing heroin, and the third one is again IV route, where the brown sugar is heated on a spoon, and then after liquefaction it is taken in IV form. So fatal dose is 50 milligrams. They are metabolized to monoacetyl morphine or acetyl morphine, and finally to the morphine, which has a half-life of 38 minutes. So chemical analysis will detect morphine but not heroin. So this is one point you have to remember. So chemical analysis will detect morphine but not heroin. After injection, morphine and monoacetyl morphine are found in urine almost immediately, and tolerance occurs very rapidly within days and can be increased to more than 100 times the initial dose. So tolerance means where the person will not get euphoria effects with the same doses as the passage of time. So the person needs more doses to get the same effects. So that is called tolerance. So the heroin has tolerance will develop very rapidly, and then there is every chance that the person will increase the dose from 1 to 100 times the initial dose. So fatal dose is 50 mg. So to monoacetyl morphine or acetyl morphine to morphine. Only morphine is detectable, and it can be easily available or detected in the urine, and then tolerance will develop immediately. So these are some of the effects of heroin, both short-term effects and long-term effects. So you can see central effects. The heroin will produce euphoria, alteredness of the alert and drowsy state, and then there can be dryness of the mouth, warm skin fluctuations, there is slowing of breathing, and then there is muscular weakness. Whereas long-term effects of heroin, we have addiction, tolerance, and dependence. So the addiction means the person cannot survive, or the person cannot, if he is not taking, then the withdrawal symptoms will occur. Addiction, he is addicted to it. So without the heroin, his well-being, he will have palpitations, he will have headache. So all the psychological effects and physical appearance will be having problem with if he is not taking the heroin doses. So he was addicted. And then tolerance, we have known that tolerance means to get the same effects, the dosage has to be increased. And dependence means he has physical symptoms but not psychological. So psychologically he has a dependent nature, but physically even if he is not taking, nothing will happen. Dependence is just like we are taking tea and coffee. You know, some people they like tea and coffee, so they want to take, but even if the tea and coffee is not available, nothing will happen. So there is a psychological nature that to drink tea or coffee at 6 o'clock in the morning or 4 o'clock in the evening, but even if the tea or coffee is missed, nothing, any symptoms doesn't develop, like palpitations or breathlessness or any irritation. No sorts of that thing will occur in case of dependence. Whereas in case of addiction, the symptoms will develop. Physical symptoms will develop in addiction. So unless you give the dosage, the patient will not be has a feeling of calmness. And then we have circulatory collapse. We have infection of the heart linings and valves because of the injections. And then you have pneumonia. You can have liver dysfunction, and then abscesses because of the multiple injections on the hands or on the elbow regions. So these are some of the effects. And then these are again the same things. There is intense euphoria followed by sedation for about 1 hour. And then these effects are completely lost in 3 to 6 hours. So there is release of histamines, thereby there is intense itching. So causes excitation by lifting cortical inhibition similar to alcohol. And then there is sudden death. There can be sudden death even in addicts with the needle still in vein. So it is called death on needle. So death on needle is where the person can die suddenly while taking injection while the needle is still in the vein. And then it is because it is a very strong CNS depressant action and it has a very high hypersensitivity reaction. And drug abusers elbow or myositis ossificans can develop. So all these things are some of the effects of heroin. So it has intense euphoria followed by sedation for 1 hour, and then effects completely lost within 3 hours to 6 hours. The intense pruritus because of the release of histamines. The effects, it will inhibit cortical inhibition, and then excitation by lifting cortical inhibition. So it elevates the mood by inhibiting the cortical nature of inhibition of the excited nature, and then it causes sudden death while needle is still in the vein because of the hypersensitivity reaction. And then you can have drug abusers, abscesses at the elbow, and then the muscle changes can occur like myositis ossificans, where the muscle becomes inflamed and then hard. What is the treatment for this? Treatment is methadone 40 mg daily In chronic addicts, we give 80 mg. Heroin addicts should never be given 20 mg methadone at once. So it's only by gradual reducing the dose by 20%. We have to adjust only on a supervision of psychologist or psychiatrist. We need to undergo treatment. So we can detoxification can be done. And then antagonists, narcotic antagonists like naltrexone, naloxone, haloperidol, clonidine, cyclozicin are of some usefulness here. And what are the PM findings? PM findings, we can see multiple injection marks on forearms in case of addicts, and then heroin lungs, which are edematous, congested, and then they're filled with froth and foreign body granulomas. So that is called heroin lung, where the lungs are edematous, congested, filled with froth, and then foreign body granulomas. So treatment wise, methadone is a choice, 40 milligrams daily. If it is addicts, 80 milligrams. So morphine, the same like opium, it has the same, morphine primary source is opium poppy, then mainly used an analgesic. It is the most potent analgesic nowadays. It can be used orally, both intramuscular, subcutaneous, and intravenous. It has high potential for abuse and addiction, and it is illegally, it can be obtained from codeine found in over-the-counter cough preparations, and then it can be also extracted from tablets of MS content, but usually the amount is less. Addiction symptoms and treatment similar to heroin, and the most common side effects are respiratory depression and then constipation. Respiratory depression and constipation. And pethidine, again, it has a colorless crystalline powder with bitter taste. It can be taken IM or IV route. Pharmacological effects are similar to morphine. And then 100 mg of pethidine IV is equal to 10 mg morphine. And it has no effect on cough, bronchial, or gastrointestinal smooth muscles. So just for the completion's sake, we are dealing with this. But most important thing in CNS depressants is alcohol. We have to study alcohol, all the stages, mechanism of action, their effects on the CNS, and then the management, and then medical legal importance. And then we have opium. Opium is also very important, asked many times. Alcohol has been asked many times in the examination. Opium has been asked in the examination, and also heroin has been asked in the examination. So all these things. So pethidine, it is used to replace morphine to relieve intense pain. Pethidine is used to treat pulmonary edema, acute pulmonary edema. It is not useful for a diarrhea or cough. So fatal dose is about 2 grams and fatal period is about 24 hours. So pethidine causes more dizziness than morphine, and it has a greater elation. There is impairment of ability to work is more when with compared to morphine, and tolerance to its toxic effects is not complete. And addicts may have twitchings, tremors, mental confusion, hallucinations, dilatation of the pupil, dry mouth, and sometimes convulsion. So these are all the same symptomatology as of morphine poisoning or even the opium poisoning. So treatment, we give opioid antagonist, naloxone, diazepam, and then carbamazepine. So methadone, again, it is a long-acting synthetic opioid. It is an analgesic effect is equal to morphine in potency and action duration, but more effect in oral administration than morphine. So again, the methadone is also used as an analgesic. It suppresses withdrawal syndrome. It is used in the treatment of heroin. Very important. Methadone 40 milligrams is used. In addicts, we give 80 milligrams. Methadone is substituted for injected opioids, and patient is then slowly weaned. So physical dependence occurs slowly, and withdrawal syndrome is mild in case of methadone poisoning. So these are some of the other CNS depressants along with morphine, pethidine, and methadone. And next one is codeine. Codeine, it is also synonymous to methyl morphine. It has a low affinity for opiate receptors. Its analgesic effect is mainly due to conversion to morphine. So codeine is converted to morphine. So cough suppression action is mediated by receptors other than opioid receptors where codeine binds itself. So whatever the mechanism is, it is converted into morphine. It has the same analgesic effect as morphine. So what is the forensic significance? It can be used for illicit synthesis of morphine and heroin, and resultant product is known as home bake. So normally these cough syrups are taken, and then from that this morphine and heroin are prepared. So it is known as home bake. So another drug is fentanyl. So all these drugs, I think you have known in your pharmacology. So not much importance is there, and it has not been asked many times in the examination. Just for completion sake, we are dealing. So fentanyl also, it is a potent narcotic opioid. Analgesic effect is about 80 to 100 times more than morphine, and roughly about 40 to 50 times more potent than pharmacological grade 100% pure heroin. It is a strong agonist at the mu opioid receptors. Commonly, it is used as an anesthetic agent. Fentanyl analogs tend to produce significantly more respiratory depression, making it somewhat more dangerous than heroin. So fentanyl has more respiratory depression than heroin. And illegally, it can be used orally, smoked, snorted, or injected, and famous for drug addiction. So fentanyl is also, it has drug addiction properties. Poppy seeds, you know that we have seen already opium. So poppy seeds are used in routine cooking, but still do contain some traces of morphine and codeine. The problem will occur if you take large amount of poppy seeds. Eating a large quantity of these seeds can lead to positive screening of both alkaloids. So these are some of the opium and its derivatives: opium, heroin, morphine, pethidine, codeine, and fentanyl. So opium and its derivatives. So any of the things can be asked. So mostly opium, heroin has been asked. Opium has been frequently asked. Morphine, pethidine, codeine, fentanyl are rarely asked. So as far as I know, they have not been asked. So opium has been asked. Speedballs have been asked. There, heroin has been asked, and then recreational drugs is a very short notes for you. So please study CNS depressants. That is a very important chapter. So definitely you will get one question, either in a very short, or it can be also a short notes. So these are the other things which are not necessary for you. So and then in this chapter we have barbiturates and benzodiazepine poisoning also. So please study, because in pharmacology you have learned a lot about barbiturates and benzodiazepines classification. We have diazepam, all these things. So please study them also in this CNS poisoning, but not very much asked. So that's it for CNS depressants. From next class, we will start another topic. Thank you for your patient listening, and thank you very much. You can leave now.